Good afternoon, everyone. Welcome to today's session, where we will be discussing about code of conduct and ethics. Our presenter is Karen Njoroge, a registered nurse in Kenyatta National Hospital, working in Corruption Prevention Committee Secretariat. She has vast knowledge in issues of conduct, code of conduct, professionalism, integrity, and respect. We are going to invite her to take us through the code of conduct. Welcome, Karen Njoroge.
Thank you, Jemima. Kindly, Nelson, if you could stop sharing so that I can share my slides. Thank you. So as has Jemima said, today we will be looking at the KNH code of conduct, and I would encourage active participation. So to begin with, I will be requesting you to chit chat with us, the panelists, and answer the following questions. So question number 1, we are asking, what are the fundamental rights and freedom? What are the fundamental rights and freedoms? And as employees of Kenyatta National Hospital, what are assets that are under our care? The assets that are at our workstations? And how can we enrich ourselves in our workstations? Those are 3 questions just to kickstart our conversation today. What are the fundamental rights and freedoms? And give example of few of them if you can. What are the assets under our care, and how we can reach ourselves using our offices? So to start with, I will start with the words of Warren Buffett, whereby he stated that in looking for people to hire, you look for 3 qualities. That is integrity, intelligence, and energy. And if they don't have the first, the other 2 will kill you. So what is the first? Everyone who is in employment has to have integrity. Despite having intelligence in your performance of duties, and instead of having energy, you also need to have integrity as an added advantage. To illustrate this, I will give an example of what happened in the KRA system, whereby they employed very young people who had a lot of energy, but they lacked their integrity, and therefore they hacked into their system and therefore stole a lot of money from the employer. So what are we saying? We are saying that if we are looking for people to hire, we look for these 3 qualities, among them integrity as a priority. So the KNH code of conduct applies to the board, the management, staff, students, interns, and suppliers of Kenyatta National Hospital. If you are a student or an intern and you are in the premises of KNH, we want you to behave in a manner that abides by the KNH code of conduct, our suppliers and also our staffs. So what are the objectives of having the KNH code of conduct? Number 1 is to strengthen organization culture and shared values, whereby we all come from diverse nationalities, ethnicity, and therefore we are brought together by a common goal, the service to the people of Kenya. And therefore, whatever we have, whatever we do in our own areas, when we come to Kenyatta, we don't do that. We are guided by a certain rules and regulation, which is the code of conduct. Number 2, it is to enhance ethical and professional understanding, whereby we are supposed to perform our duties in a manner that that shows professionalism as we are doing our day-to-day running of our businesses. And also we need to have ethical standards as we provide services to the people. And then the objective number 3, it is to promote acceptable behavior. So as other than knowing what it entails in the KNH code of conduct, you're also expected to know what is in the Constitution of Kenya 2010, also what is in the Leadership and Integrity Act of 2012, the Public Officers Ethics Act of 2003, and the Kenyatta National Hospital Terms and Conditions of Service. As public officers, we are guided by these 3, the Constitution of Kenya, the Leadership and Integrity Act, and the Public Officers Ethics Act. Kindly do go read about them and enhance our knowledge on what it entails. So our guiding values, we are focused on the customer. Remember, our main focus is customer. Without our customers, we wouldn't be here. And therefore, we are supposed to be empathetic and caring. And therefore, we are supposed to treat all people with worth and dignity and providing timely delivery of services. Whenever we are serving our patients, we need to put ourselves in their shoes and understand them from their point of view and provide worthy and dignity services to the people. Are you providing timely and effective services to these people? Sometimes in our clinic, they are flooded. What time do the clinic start? Do we usually think on what time these patients came to us seeking for services? And therefore, we encourage to do customer-focused services. The other guiding value is about transparency and accountability, whereby we are supposed to be responsible for the activities and actions that we have done and to disclose the results in an open manner. Sometimes incidences happen in our premises. Are we transparent in narrating the account of the event? Are we accountable for our action in case you have done something and it brings negative implication? Are we able to own up for our own mistakes, or do we hide behind the paper and the right things that we do? Therefore, the KNH Code of Conduct encourages us to be transparent and accountable for our activities and our action. We also need to be equal, to provide equity and equality by serving all customers with fairness and impartiality. Without fairness, we can't provide services that are biased, and therefore we encourage to provide services which have fairness and impartiality. The issue of professionalism and integrity, whereby when we are seeking for employment, we all received employment based on the competency and the skills that we have acquired. And therefore, we need to be ethical, honest, and having strong moral principles. We are not supposed to be doing something wrong because so-and-so is doing so. Remember, when something happens and you are caught, it's you you have to have a personal responsibility. And therefore, you are encouraged to do things that are ethical, honest, and moral principles. The guiding principle value on security and safety, whereby we are supposed to offer services in a secure environment, free from errors, accident, injuries, and infection. For those of us who are performing procedures in the ward, do we prevent cross-infection? For those of us in our clinic, are the clinic area free of things that can cause accident to our patients? The errors that happen, the medical errors, do we report them? Remember, we are doing all these things to improve service delivery to the people. It's all about our customer. Then there is the final one on the teamwork and the team spirit, whereby we are supposed to have cooperative or coordinated efforts among staff working together for the interest of a common cause in the hospital. This is where we call for people to be as a team. You can't work as an individual. For us to achieve the desired result, we need to involve each and every team player in that team working in a certain day. So I will ask my moderator to read for us some of the answers that you have given on the fundamental rights and freedom. So, okay, there is none. So anyone who is willing to chat, what are the fundamentals, examples of the fundamental rights and freedom? Remember, the patients that we are dealing with, they are very, very well informed. They know their rights. And therefore, if we don't know these rights, how can we protect, respect their decision? Whose code of conduct is emphasizing on the respect, protecting, and promoting the fundamental rights and freedom without discrimination. So what are these fundamental rights and freedom? Right to life, thank you, Jogona. Right to information pertaining their treatment, right to their privacy, right to confidentiality, condens, right to consent, keep them coming, right to information, right to be treated with respect, right to seek services, right to privacy, treatment, and consent, right to refuse treatment, autonomy. Thank you very much for those of us who have responded. Remember, our clients, they know their rights. They have right to confidentiality, right to privacy, freedom of worship, freedom of speech, freedom of expression. I will kindly urge you to go and read Constitution of Kenya, Chapter 4, especially Article 10. All those rights are enshrined there in the Constitution. The other aspect on professionalism, we are supposed to carry out our duties in a manner that upholds public confidence, e.g. of observing official working hours, professional standards of performance, and personal hygiene. We have said that we are dealing with clients who come from far away from our Nairobi city. Some come as far as from Kisumu, Murang'a, Kiambu. Whenever they come to our clinic, are we providing services in a timely manner? Are we observing our official working hours? If you're supposed to report to work at 8, what time do you come in to work? Our clocking in register can tell a lot. Some people come at 8:30, but when you go to the clocking in register, you find that everyone has clocked in at 8. And then you wonder, did we all come at 8 or what happened? Not even 8:01, it's all 8. So are we people of integrity that we have said that we need to be transparent and accountable? Are we accountable when we come to work during work, when we come to work late? Are we accountable when we leave work early? And when we talk about personal hygiene, are we observing personal hygiene? Are we coming to work when we are well groomed? Or we are just picking something, dressing up, and then showing up at our work of place, and then our client will be wondering, are these people under payroll? When we are talking about professionalism, we want people to see us as professionals and not people who are just picked from somewhere. Because remember, we got this job because we qualified for it, and we showed that we had the skills to perform. So I had asked another question on how people can they can enrich themselves in their workstation. Let's keep going through the chat. I will be reading them through. How can we enrich ourselves in our work areas or in our offices? Is there a way that we can enrich ourselves? Remember, we are talking about the code of conduct, how we are supposed to conduct our businesses in departmental meetings. Yes. Chit chat with Jemima and Carol on job training, continuous professional development, receiving bribes and kickback. Yes. Setting goals. Keep them coming. How can we enrich ourselves as we are providing services? Kuna mahali file haipatikani, unaitisha kitu ndo file.
Yes, just a moment to please. We are experiencing some technical hitches. We are trying to fix it as quick as possible to get the presenter back online. Kindly just wait. Thank you.
Sorry about that. Thank you, Jemima and Nelson, for holding in for me. we were talking about the improper enrichment. We have given example on how we can enrich ourselves, things to do with training, things to do with customer service delivery, record keeping. We cannot records, and therefore the KNH Code of Conduct says that we shall not use your office to enrich yourself, and we shall not evade paying taxes or neglect your financial obligations. And as employees, we are not supposed to accept personal loans or benefit which may compromise our provision of duties. As we proceed on, we are going to look at the conflict of interest. How does it happen? So conflict of interest is a situation that compromises your objectivity or your own personal interest, brings a conflict between the organization goal. And therefore, once a conflict of interest is there, you're supposed to excuse yourself from any decision making that may create the conflict with your private interest. This is done in writing. And you're not supposed to allow any relationship with suppliers to influence decision. You're also supposed to refrain from direct use or allowing use of hospital property for anything other than the official approved activities. How can we use the official items property, office property for unapproved activities? I will give an example. Some of us, we are in school. Sometimes we are given research to print and we come with our work to print our workplaces. Our cartridge ya job inaisha, printing papers tunatumia za kazini, and then tunasema hatuna resources za kazi. Yet it's us who has used the resources in a manner that we are not supposed to use, and therefore that brings a conflict of interest. Management or career planning of any relative, and therefore if you are working in a department where your family member is there, kindly report to your supervisor so that they can be assigned to other department, therefore eliminating the risk of the conflict of interest. We shall not make improper use of position or confidential information gained in that position to achieve personal interest, or we need to maintain confidentiality of patient information. And you are not supposed to participate in tender for supply of services to the hospital. As employees of Kenyatta National Hospital or as government employees, you are not supposed to be participating in tendering processes of items that you are supposed to be used in your workstation. And therefore, the hospital maintains a register to record conflict of interest. I will be displaying the same later. Political neutrality, we have just concluded August 2022, the most awaited month of the agent for or further the interest of a political party or candidate of an election, and we shall not engage in any political activity that may compromise or be seen to compromise political neutrality. And we are not supposed to adorn ourselves with symbols or clothing associated with political party. And we are not supposed to use hospital resources to advance any political cause or view. And now here is where our problem is. We are all discussing what is it called? The judgment and what the future holds. And therefore, we are reminded by the KNH Code of Conduct that we are not supposed to be making speeches, propaganda, or joining in demonstration in favor of any political cause anywhere within the hospital premises or anywhere else during official working hours. Gifts and benefits and favors. Any gift you receive while you're on duty is considered as a gift to the hospital. Why are we saying that? Kindly chat with us. Why are we saying that a gift donation to employee on official capacity shall be treated as a gift to the hospital? Keep the chat coming while we are saying that. Why are we saying that any gift that is given to an employee shall be considered as a gift to the hospital? Kindly chat. Engage us. To avoid bribes, it's given in the name of hospital. Thank you. Keep them coming. All right, I think I will help. So the reason why we are saying to reduce cases of corruption leads to corruption. The service offered is considered as service, yes, by the fact that employees facility and the gift, yeah. So the reason why we are saying that a gift donation to an employee is a gift to the hospital, remember you are on payroll, you are being paid to provide these services to the people. And therefore, you are being gifted for the services that you have provided, which the hospital has already paid you for. And therefore, any gift you receive, it's considered to be a gift to the institution. Okay, we are not supposed to solicit or accept gifts, hospitality, or any other benefits. And we are also told that we may receive a gift that is within the ordinary bounds of propriety, a usual expression of courtesy or protocol, and within the ordinary standards of hospitality. And the gift does not exceed the value of Kenya shillings to 20,000. And therefore, once you receive your gift, you are supposed to declare it to your supervisor within the 14 days upon receipt of the same. The patient or the giver is at the time, and you as a provider is being paid for the services. Thank you. So those are some instances on which you can receive a gift or favor. And we are being encouraged that we are not supposed to request for, you are not solicit to be given any gift. A moment, I sort my slides, they are not moving. There are some instances in which we are not supposed to receive a gift. These include, you are not supposed to receive a gift from a person who is under investigation, a person who has a contractual or similar relationship with the hospital, or a person who has an interest that is directly or indirectly connected with the employee duties. Or you're not supposed to accept any type of gift that is prohibited under the Leadership and Integrity Act of 2012 or any other relevant statutes and policies. These include gift made of ivory, since ivory is banned in Kenya. Your integrity, objectivity, and impartiality. And therefore, I will pose a question for you. Is there any gift that cannot compromise your objectivity and impartiality? Let's chat. Is there any gift that cannot compromise your integrity, objectivity, and impartiality? No, none exactly. It will. None at all. None. Yeah, there is no gift that cannot compromise your integrity and objectivity. For example, if a client comes to your clinic and every day they come, sorry about the internet issues. Just to respond to a few questions that I was able to grasp. Someone has asked if someone brings a pizza for lunch, whether that is a gift. Yes, it's a gift and you're supposed to declare it to your supervisor. The other one on the med reps, the pens they give you and the prescription pads, they have their information branded and therefore they are advertising their services. And therefore, if you are prescribing something for the patient and then you see the dawa that has been advertised there, it can easily alter your judgment and maybe whatever you are going to prescribe, it will be on that case, on the prescription part that you've been given.
The other comment was on thank you card gifts. Comment on that.
A thank you card gift is given to the whole world. As we shall be displaying the gift declaration form, we shall be looking at some of the ways that a gift can be disposed. Among them, it can be shared among the staff members. It can be retained by the person who has been offered the gift, or it can be kept in an office as a souvenir. We shall be looking at that shortly.
The other comment is, what if a client gives you a gift
outside the hospital,
leave it on your table forcibly? Comment on that.
That one, we are saying that it's not bad for you to receive a gift, but what you do after receiving the gift, it's what matters. So any gift that is offered for you and you decide to receive, you are supposed to declare to your supervisor. The underlining part is the part of where we are supposed to declare. Are we people that are honest? Are we people that can be accountable? Did you declare or you just receive and pocket it? We shall be looking at the declaration forms later on. Somebody had asked about
when an organization pays you money to conduct the training for free, then you charge the participants.
When an organization
from outside, maybe
when an organization, sorry?
When an organization pay you money to conduct the training free, then you charge the participants.
We shall be deliberating that as we continue.
What is a gift less than 20,000?
I remember I had given an assignment that we are supposed to go read about the Leadership and Integrity Act and the Public Officers Ethics Act. All these things that we are discussing, they are discussed there in depth, and therefore I will return the question back to you. Kindly let's go do our homework, and if there is still some issues and or areas of concern, we shall be responding to them. Proceeding on, we look at the public reports. What are we supposed to do when we encounter public reports? Public reports are things to do with our patient. Remember here, our core business is the patient. So we are not supposed to share any public reports with people outside our workstations. So we encourage to maintain appropriate books, records, and accounts in a reasonable detail in order to accurately reflect all hospital transactions. In our various workstations, I'm sure we have registers, we have books, and we have cadexes. So whatever information that we are providing in those books, it should be reasonable. It has details in order to accurately reflect all hospital transactions, and must not under any circumstance engage in inaccurate, false, or misleading record keeping. Most of the time we want to save ourselves, and therefore, for example, in cases of nurses, sorry to give that example, maybe you are in the ward and you are nursing a patient, and then maybe an incident happened, you had documented all your cardex up to maybe 5:30. And for instance, maybe your patient succumbs before 5:30. What do? Sometimes we prac the cardex and we start redoing the cardex from afresh so that we can add the new information. Is the information that we are providing accurate? Have you forged the information? Since you have to look for the people who had documented before you for them to do their part so that you can also do your part. And therefore, we are being told that we are supposed to maintain appropriate book records. And we are not supposed to alter any information or provide inaccurate, false, or misleading record keeping. And we also encourage not to directly or indirectly use or allow any person to use any information obtained through or in connection with the office that is not in public domain for furthering of any private interest. Many are the times we have bloggers that maybe they would like to corroborate a story. We are not supposed to do that, and any information that goes to the public through the Kenyatta, it has to go through the marketing and communication department with an approval from the CEO. Fundraising. I hope we are not being engaged as a guest of honors in our church services. When it comes to fundraising, we encourage that we are not supposed to use our office or place of work as a venue for soliciting or correcting harambes. Bado watu wanapeana zile cards za 1,500. If we are doing that, that needs to be stopped, because as KNH Code of Conduct states, we are not supposed to use our offices or places of work as a venue for soliciting or correcting for harambes. We are not supposed to solicit for contribution from the public for a public purpose unless the president has keep the charts coming. What equipment do you have under your care? Assets that are under our care. Chairs. The hospital program on your computer, hospital furniture, customers, furniture in the facilities, personnel, fridges, furniture, material, human resource, finance information, fridges, lab, consumable equipment, facility data, surgery instruments, surgical sets, building, drugs, client properties, patients' files, computers, patients' information, time. Okay, thank you very much for your feedback. And therefore, in the care of property, we are told that we shall take all reasonable steps to ensure that the hospital property that is entrusted to their care is adequately protected and not misused or misappropriated. How do we use our computers? Are we using them in a manner that it is protected and not misused or misappropriated? And therefore, in the care of assets, we are being encouraged that we should protect them. How are we supposed to conduct ourselves in public? A board member, management, staff, or student, or in turn, shall conduct him or herself with dignity both in public and in private. Whenever we go to have fun in a manner that portrays you as Dr. Kenyatta. Remember, out there, we are all doctors. They don't differentiate who is a cashier, who is a doctor, who is a nurse, who is a porter. We are all termed as doctors, and therefore, whenever we are conducting our businesses in public, we are supposed to do so in a manner that upholds public trust as doctors of whatever institution that we are working, and not behaving in this manner. Huyu ndiye serikali, habari ndio hiyo, and then these people are just looking at him. Look at how bwana mkubwa is behaving. We need to behave in a manner that upholds our respect, dignity, and our integrity. Harassment, sexual harassment. We have two types of harassment: workplace harassment and the sexual harassment. So sexual harassment refers to unwelcome sexual advances, requests for sexual favors, and other verbal or physical harassment of sexual in nature, which affects individuals' employment and unreasonably interferes with the individual work performance or creates an intimidating, hostile, or offensive work environment. Do sexual harassment happen in our workplaces? Do sexual harassment happen? Yes, yes, it does. And therefore, yeah, the answer is yes. Thank you for your responses. So what we are saying that sexual harassment can occur in so many forms, and therefore there was a study that was conducted in KNH in 2012, and this is a staff. These were her thoughts, and I will read them. She said, "I lost great interest in my workplace. I could not stand the sight of the man who had attempted to kiss me by force. When we were leaving the office, I feared for the worst. I was just apprehensive at his sight and always lost the steam to work. I had to take sick of leave, even though the doctors could find nothing to treat. My performance was at its lowest till he was transferred to a different department." From this study, we can see how sexual harassment affects work output, how it affects our staff psychologically, and therefore we are encouraging people to report. In case you have something that is bothering you, kindly come and report, and we shall follow up on the same. In the two pictures, is there anything wrong with the pictures? Let's chat about it. Is there something wrong with the first picture and the second one? Is this lady amused about the touch? Look at this gentleman. Is he happy about how close this lady is? Social distance. We are encouraged to maintain social distance. Yes. Inappropriate touch. Inappropriate touch. They are not okay. Huh? They are both not happy. The first one seemed to be enjoying. Personal distance. That's harassment. All right, thank you for your feedback. So we can see from the photos, this one was trying to show this gentleman something, and instead of concentrating on the keyboard, she's amused about how his hand is being placed on her shoulders, and now the concentration is on where the hand is. In this other photo, this lady is just too close, and this one is very much surprised. So we are saying that we need to create a workplace that is conducive for everyone. So sexual harassment can occur in a variety of circumstances, including but not limited to the following: that the victim as well, the harasser, may be a woman or a man. I can see the boy child is under siege. What happened to the men that we used to have in past? Siku hizi wanaonewa sana. So we are saying that the victim can be a man or a woman. It can happen as an intentional physical contact that are sexual in nature. Maybe I was greeting you and instead I give you my hand, but you go ahead and grab me for a hug. That is sexual harassment. It can occur also as a sexual proposition, making gestures, noises, advances, or sexist jokes or comments that are insulting. Maybe somebody has a nice figure, anapita too, and then you hear ameumbwa. So what does my shape has to do with their thoughts? Let's refrain from making thoughts that can be harmful to people, or people can fear coming to your office if they know that whenever they come, there will be some jokes that will not go well with them. So it can also be demeaning or derogatory behavior towards a person because of a gender, which is obviously offensive, or continue even after the speaker informed that those comments have caused offense. Many are the times that we speak up, that we don't enjoy what a person tells you. Remember, when a girl says no, or if a man says no, no means no and not any other. No is a no, yes is a yes. Please, let's not misinterpret the context of anything. So workplace harassment, we encourage not to bully our colleagues or members of the public. Repeated offensive behavior that is cruel, malicious, or humiliating and is intended to undermine the person. In our institution, we are the referral and training and referral institution. Sometimes we get students. How do we mold our students? Are we cruel to them? Are we humiliating them? Remember, my own understanding cannot be the same as Jemima, and therefore you need to come up at a level that you can meet both of us at our point of understanding. And therefore you do not make us to feel that maybe we chose the wrong career. So we shall not threaten, belittle, abuse, or demonstrate unwelcome behavior to colleagues or members of the public. Just imagine, this is a husband to someone, a father to someone, but ameambiwa yeye ni bure kabisa. The reason being just putting 3 teaspoons of sugar instead of 2. There is a better way of telling him other than just telling him like this and maybe burning him with the hot tea. And also remember, people are fighting and battling different battles. And when we belittle them or make them feel small, whatever may be issues they are dealing with, they may come to a breaking point and maybe commit suicide. What have we done? Are we being a person's keeper, or we are just putting them into the grave? Kindly, let's be kind in our workplaces. Use of ICT. Incidental personal use must not interfere with the operation of ICT resources. And when it comes to the use of social media platforms, an employee on social media shall ensure that content published, written, or shared through the social media platform does not degrade or intimidate a recipient of the content and is not prejudicial against a person or group of people based on their race, gender, ethnicity, nationality, religion, political affiliation, language, ability, or appearance, and is fair, accurate, and unbiased. Kindly let's refrain from posting the forwarded messages that can be unkind to some people or a group of people. I know a few messages have been circulating about the just concluded judgment. Kindly let's refrain from posting such, because some are celebrating, others are mourning. So we need to be at a level where we can meet each and everyone at a certain level. Let's refrain from forwarding such messages to the group, the WhatsApp groups that are Kenyatta related, so that we can be fair to each and every one of us. Communication with the social media or media news. Employees who are intent on giving contribution or stories, incidents, or sensitive issues shall convey the same message to the marketing and communication manager as soon as possible so that facts can be established and timely response made through the appropriate channels. Employees of various disciplines may respond to media inquiries directly when acting in their areas of professional practice or expertise with approval from the CEO. So this is where we emphasizing that any story or any news that has to go to the external people, it has to go through the marketing with an approval of the CEO. What about acting through others? Do we just receive orders and we go ahead and act? Remember, the code of conduct says that if you are acting through others, contravenes the code if he or she causes anything to be done through another person that would constitute a contravention of the code. There is somewhere that we talked about, we shall talk about the lawful instructions and the unlawful instructions. So if you are acting through others, kindly ensure that the message that you are sending is a lawful instruction. Confidentiality, what do we do with the patient information? KNH Code of Conduct emphasizes that we shall take reasonable steps to limit the use of, disclosure of, and request for patient health information to the minimum necessary to accomplish the intended purpose or as permitted by the Constitution of Kenya. We shall not discuss patient information in public. Such information can only be discussed with personnel directly dealing with that particular patient. Sometimes in Kenyatta, we get very interesting stories or cases, and therefore we get excited to discuss it. Imagine if you are discussing this case and a patient relative is behind you, and when you are discussing this case, maybe you are in a bus going away from your workstation or going home, and then they hear their story. Will they ever trust us with their information? Because they gave this information knowing that they have a right to privacy and confidentiality, yet we are discussing their patient's case on our way back home in a matatu. Remember how many people can listen to that conversation. We need to protect our patient information and maintain confidentiality. An employee shall not disclose confidential information to third parties in a manner that injures the credibility of Kenyatta National Hospital. Alcohol and drug abuse. The hospital is alcohol and drug abuse-free institution, and therefore staff shall abide by the policy prohibiting illegal possession, distribution, use, or being under the influence of alcohol or any other substances as stipulated in Section 14 of Public Officers Ethics Act of 2003. If you are an employee and you have a problem, remember there are channels of helping yourself or your other staff that may be struggling with this, and they can get help through the employee assistance program. There are channels that can be used for you to get help, so don't shy off. We have the program for you and you can get the help that you need. Punctuality and availability. Remember, as Kenyatta National Hospital employees, we are supposed to give 8 hours every day and a maximum of 40 hours per week. So therefore, the KNH Code of Conduct emphasizes on the punctuality on duty and shall be available at all times. Why have we highlighted the available at all times? Many other times, maybe we come on duty, we report, we are seen, we are there, or we just leave our handbags or our jacket on our chair that represents that we are on duty, but we are nowhere to be seen physically. So the code emphasizes on being available at all times. Remember, if a client comes to your office to seek service, na anapata tu jacket, are we providing the timely, efficient services that we are emphasizing? And therefore, ensure that you observe the official working hours, that is 8 a.m. to 5 o'clock. And you're entitled to your 1 hour lunch break. And therefore, the code also states that due to the nature of hospital operations, staff may be required to avail themselves beyond the stipulated working hours. What is our dress code? We shall at all times be expected to dress decently while on duty. And those working in areas where they are required to wear uniforms or protective gears shall comply and maintain an appropriate standard of dress and a professional hygiene. Just imagine if we take this to be a procedure room, is there any procedure that is happening here? If this person was cracking a patient and all the concentration is around here, are we doing justice? So as we proceed, what is borrowing and lending? We are forbidden from borrowing and lending from all fellow employees or members of the public. If someone has your money, kindly go get your money, and from here on henceforth, there is no borrowing or lending from colleagues or members of the public. Obedient to the lawful instructions, we are being told that we must obey to lawful instructions of those placed in authority over them. This includes our supervisors. Pecuniary embarrassment, we are being told that we shall manage and conduct our finances affairs in sensible and responsibly to avoid being exposed to financial embarrassment. Many at the time, the HR people ensure that we have maintained the third rule of our salaries. But kuna kitu inaitwa kwa mama. Unajua uko na 1/3, HR inajua iko na 1/3, but ukienda kwa mama unabaki na negative. Are we conducting our finances sensibly and responsibly? Are we exposing the hospital to pecuniary embarrassment? KNH is the best employer. We are remunerated well, and therefore we are supposed to arrive that is within our standards and arrive that you can comfortably afford, so that you avoid being embarrassing the hospital. Whistleblowing. We encourage whistleblowing or reporting of any unethical behavior, and therefore, as a staff, you shall report any person who has not acted within the code as prescribed in the KNH whistleblower protection policy. We have a policy that protects you as a whistleblower, and we shall be looking at it sometimes later when scheduled for the same. So what will be your penalty? A disciplinary action shall be taken in the case of the violation of the code of conduct and ethics in accordance with the hospital human resource instrument, referral to their respective running institution in the cases of student, or to the Ethics and Anti-Corruption Commission. Wherever we are, I would encourage us to read this together. These are the words of Napoleon Hill, where he stated that, kindly let's read together in wherever we are. When you are able to maintain your own higher standards of integrity, regardless of what others may do, you are destined for greatness. Napoleon said that when you are able to maintain your own higher standards of integrity, regardless of what others may do, you are destined for greatness. Remember, sometimes we do service to the people. We are not providing these services so that your supervisor can see and reward you. We are doing these services because it's your own personal initiative and you want to get the job satisfaction that you want. But if you do things so that other people can see and acknowledge you, then you have a problem. We need to do things so that we can also be at peace with ourselves. We can acknowledge what we have done. And therefore, if we are doing things just because it's us who we are doing this for us, then we are destined for greatness. That brings me to the end of our presentation for today. I will take the questions.
Thank you so much, Carol, for the elaborate presentation. I have a few comments from from the participants. Somebody says, who do you complain to if the boss or your employer is harassing you sexually or physically?
Thank you. We shall be displaying the reporting channels as I end this.
The other one is about the WhatsApp Changa groups where we are asked to Changa for a particular cause. Is it encouraged in the hospital?
We have said that anything that you contribute has to have an approval from the CEO. Are the Mchangos been approved?
The other one is about the Harambee forms that goes around in the wards. Are we allowed to contribute, or do we criminalize the person who has brought the form?
If the forms have the approval from the CEO, then there is no problem. And sometimes we have said that we can do the corporate social responsibility mchangos.
Kindly comment on the use of WhatsApp for official communication.
By official communication, what do you mean? Maybe sending memos?
Is there a policy that protects staff from harassment from clients? And in line with this, how do you handle such cases?
As I've said, when we will be going through the KNH whistleblower protection policy, it protects you as a whistleblower, and it also protects the patient as a whistleblower. And we shall be looking at some of the instances where you can whistleblow and what are the malpractices that you can report on.
Another comment is, how can one prove that they are actually sexually harassed?
Proving sexual harassment is very, it's not straightforward, but what we do, we trail the person that has been reported. Because if a person can do something to you, it means that they have been doing it and maybe they have never been caught, or they will continue doing it if they are not stopped. So if someone gives us the information, we shall find a way of getting this person involved. Maybe we can send someone just to see whether whatever accusation have been made are correct.
There are so many positive comments. They like the presentation. Thank you so much for your comments. One more comment: harassment at workplace is so rampant, especially from seniors to juniors. How do we go about this?
We report.
Report, report, report. Thank you.
We have a culture of silence, and silence will not help us. We can only act if information has been brought to the CPC office. Someone is asking whether KNH has a sexual harassment policy. Yes, we do, and a sensitization on the same were done.
Another comment: why do we want to restrict the general public from appreciating our good work as nurses to the public, to the population that feels our in our line of duty? That is from Elijah.
We are not restricting. All what we are saying, I hope this is in regard to the gift and gift declaration. All that we are saying is that whenever you receive a gift, kindly declare. Maybe this person can give you a gift, and at the end of the day, they say that they had a parcel and they lost their parcel. When a search is being conducted, you are being found with that parcel. If you did not report, how will you take yourself out of that awkward situation? Because it's you in possession of that pass. So when you declare it to your supervisor will be informed that there was this patient who gifted you this parcel. And if you are found with it, at least you will have someone to corroborate your story.
Thank you so much. I think we are done with the comments and questions.
So these are some of the reporting channels that you can report any corruption related cases or any unethical behavior. You can walk into the CPC office. We are located opposite cash point number 14. You can give us a phone call through the extension number for employees of Kenyatta 43037. Or you can call through the mobile number 0702 498 808, 0702 498 808. Or you can report through the anti-corruption reporting boxes. They are across the hospital. In each and every floor, there is one. Or you can email us at cpc@knh.or.ke, or through the online anonymous reporting. Or you can go direct to the EACC to report on the same. Just to emphasize on the online reporting, I will be taking you through how the steps to go about on the online reporting. When you type in the Kenyatta National Hospital, when you go to the KNH website, You will see the information on contact us. Just a few minutes for it to load. Remember, KNH website is www.knh.or.ke. Here we are. So it has home about our services, project, branches, media center, contact us. So you are going at the contact us and then you go to the report corruption. And then you scroll down, there is some information on how you can report anonymously and what is expected for you to give a report. So you will write your subject of the story that you want to report. So for me, it's a test. And then you give a detailed report of the account that you are reporting. And then you click submit. When you click submit, it will tell you, thank you for taking action. And therefore, this will go to the CPC email that I've provided. In case where you want to access the policy document that I've just been given, you go to the media center, then downloads, and then you go to the publications.
Please share your screen, sorry.
Sorry about that. I'm being informed that I'm not sharing my screen. So we have said that you go to the KNH website, it will give you the home about, then you go to the contact us here, you go to report corruption. It's taking a while to load. So here you are. This is the KNH website. You go to contact us, you go to report corruption. Then you scroll down, there is information on how you can report anonymously. Then you write the subject of your topic or the title. For me, it's a test, so I will write it as a test. Then you give the detailed information of the complaint that you are raising, and then you click submit. When you click submit, it will tell you, thank you for taking action, and this will be seen on the CPC email that I've provided. For the policies, I've said you go to the media center, then you go to downloads, then publications. And you will see the policies here. You have the KNH and corruption policy. We have the KNH code of conduct, and we have the whistleblower protection policy. You can read them in soft in the website. Is there any other question for us?
One more question. As a KNH staff, where do you report when you hear information you gave in confidence at a counseling leaks out?
You come to the CPC office, or you can use the provided channels and we will look at it.
For one to prove an act, one is needed to show proof for allegation. In this, is this a requirement when it comes to sexual harassment or not?
Sometimes we corroborate your story with the other employees, and we establish fact whether this has also been reported elsewhere, and also if the person that the perpetrator is also been reported severally following the same issues that been raised.
I think I'm done with the questions. Thank you so much for those who are patient with us. We are really sorry about the interruptions of the network. Any more questions from the participants? Any more question that has not been answered? So many comments about the presentation, that it was good. We really appreciate also as participants and panelists. We really appreciate your time. We really appreciate everything. So many comments about CPD points. CPD points for nurses will be availed in 48 hours. There being no other comments, I give you 1 minute in case you have a burning question.
Thank you, Peter. The presenter is chap despite the challenges.
For doctors, the CPD will be uploaded in your portal. Thank you. I have been your moderator, Jemima. Thank you so much for your time. We really appreciate. We have come to the end of our session today. Thank you so much.